But the next speaker now will be Alexander Bondar, who will be talking about ophthalmic pathologies in Baikal seals.
And hello, dear colleagues and participants of the conference. My goal for today is to show the visual impairment in Baikal seal. We will be talking about Baikal seal. We know that vision impairment is a frequent issue for both captive and wild pinnipeds. Everything seems to be very typical, but biology is different between different species of marine mammals. A little bit of a background about Baikal Lake. It is well known as a tectonic origin, located in the southern part of eastern Siberia, the deepest lake on our planet, and studies were done in Ushkani Island area. This is a small archipelago in the mid part of Baikal Lake. There are 4 islands, Большой, Долгий, Тонкий, and Круглый, and the lakes are surrounded by endemics. So our focus is on the endemic species. We have around 1,000 endemic species. Genera, 11 families and subfamilies. Unfortunately, there is a interruption. And just next slide, please. And Baikal seal is one of 3 fresh water-burden seal species. Baikal seal is one of the smallest seal species. And we performed field works in the summer 2020 as a part of seal studies, and we surveyed 1,200 of Baikal seal individuals. We operated in Ushkani Island archipelago, Tongki Island. 99.6% of individuals didn't have any visual impairments, and 0.5% 5 individuals had eyesight pathologies, but maybe there are more than that because Baikal seals keep their eyes closed. That's why we cannot account for all the individuals with the vision impairments. In most cases, ophthalmia and cornea edema, and also opacification occurred in most of the individual animals. And anatomical and physiological specificity, they do not have meibomian glands, they do not have nasolacrimal tract, and the cornea is thickened in the periphery, and it is thin in the central part. The eye lens is thicker, and it is thicker than terrestrial, but thinner than cetaceans. These are the mechanisms of adjustment to see in the air and in the water equally well. Here we can see the eye structure, and this is the cross section, and we can see one of the specificities, and the reflecting pigment is very thick. It covers the entire eye ground apart from periphery. Lens is of spheric shape, and it is different from the terrestrial species eye shape, but this is the adaptation of these animals to their conditions. Concussion of the eye apple, this is a pathology where, depending on degree of severity, the anatomic integrity is distorted. There is a mechanical injury, then immediately after, the acute increase of the ocular tension occurs, and hemodynamic and biochemical indicators of the eye are changing, and hypoxia occurs, and hypoxia is very dangerous for the retina and for the vision nerve, and going forward there can be a loss of vision. And concussion can be different depending on degree. There is a light, medium, and very severe concussion, and any concussion, even the lightest shock in the area of eye in the long-term perspective can cause significant changes in the local immunity and internal structure of the eye. Even the light concussion can cause severe lesions in the eye. And a small overview, the Baikal seal with the injury of the DO right eye and ophthalmia, and there is a certain increase of the ocular tension, and with a greater probability we can say that there was like a shock, maybe during escape from the predation. And such type of injury is a typical thing in the landlocked water bodies. So this is something that occurs a lot. And the dextraocular right eye with the temporal triangular cornea pigmentation area, diffuse edema of cornea, and neovascularization. Such injuries can be a result of medium or severe concussion. And we can say that as this eye is not functioning properly anymore. Alexander, you have 2 minutes to go. And the next slide, please. The left eye, the Baikal seal, again, axial leucoma on the cornea, and also ophthalmia is observed. Next slide shows the injury in the left eye in the Baikal seal, and you can see there is a small leucoma that looks like neovascularization, and we can say most likely this eye is not functioning properly, unfortunately. The DO right eye, there is a post-traumatic paraaxial and opacification, and also fibrosis, and it can cause pain in the animal. The right eye, the DO, the cell infiltration and neovascularization, the DO is increased. It is caused by concussion and injury. It is accompanied by the lesions of intraocular structures, hemodynamics change, and also biochemical indicators can be changed in such an injury. And we wanted to mention the clinical case, captive animal, severe concussion and pain, blepharospasm, and the blood excretion. There was a cornea perforated. And the next slide, please. And in case of correct therapeutical approach, and we applied right therapy, and the outcome is favorable, and the vision is retained. We can impact such processes, but this is a captive animal. For wildlife, it's really difficult. Hopefully, you increase your level of knowledge in the area of the vision impairment in Baikal seal. If you have questions, I will answer your questions via email. Thank you very much.
Thank you very much, Alexander.